Hi everyone, welcome to today's webinar entitled When You Can't Ask the Resident, Practice Guidelines for Asking Proxies About Resident Preferences. My name is Kendall Lesser and I am the Project Manager for Ohio's Pelican program aimed at promoting preference-based, person-centered care in Ohio's nursing homes. Before we get started with the presentation, I have a few housekeeping items to go over with you. I ask that for those of you seeking Ohio Social Work CEUs, which I believe can be transferred to nursing CEUs, to please take a moment and click on the link under the chat box and complete the form. In order to issue CEU credits, we must have a record of you signing into and out of the webinar. At the very end of the webinar, you will be asked to complete a webinar evaluation and enter the time that you exited the webinar. Please expect to receive a PDF of your CEU certificate via email within the next 2 weeks, but most likely more quickly than that. It is very important that we have documentation of every single person who is requesting CEUs. So if multiple people are viewing this webinar on one computer, each individual person needs to take a moment and sign in and sign out of the webinar, as well as complete an evaluation form at the very end. Again, the link to sign into the webinar is under the chat box, and you can just click on that link right now. During today's webinar, we will be discussing special considerations for proxy interviewing tips for incorporating friend and family insights into assessments and care planning, and identifying ways to build staff observation skills when a proxy is not available. If you have questions throughout the webinar, please type them in the Q&A chat box, and we will answer your questions at the very end of the presentation. And you'll see on the screen right now where the arrow is, that's where you can type your questions, and the panelists will be able to respond to those at the very end. Now I would like to introduce our speakers for today's webinar. Dr. Kimberly Van Heitzma is an Associate Professor of Nursing at Penn State University, as well as the Director of the Program for Person-Centered Living Systems of Care and a Senior Research Scientist at the Polisher Research Institution at Abramson Center for Jewish Life. Dr. Van Heitzma's research focuses on seeking to understand the impact of contextual issues such as the physical environment, culture of care, staff interactions, interdisciplinary team processes, and psychotherapeutic approaches to quality of life and quality of care delivery for frail seniors receiving services in a long-term care setting. Our next presenter is Dr. Katie Abbott. Dr. Abbott is the Robert H. and Nancy J. Blaney Assistant Professor of Gerontology and the Scripps Gerontology Center Research Fellow at Miami University. Dr. Abbott's research and teaching focuses on preference-based, person-centered care with a special emphasis on persons with dementia. Drs. Van Heitzma and Abbott have co-authored over a dozen peer-reviewed articles related to the PELI. I will now turn it over to Dr. Van Heitzma.
Hello, everyone, and we welcome you to this webinar. We do want to just let you know that the advice that we're providing today really comes out of our history in working for over 15 years with long-term care organizations, older adults, family members who were seeking to implement the PELI within their organizations. And so the advice that we're going to provide here today is really to help in thinking around developing an action plan as to how to use these preferences in your daily care activities, the development of procedures and policies, and formalize a standard for how these preferences can be assessed. And as was already mentioned today, the goal is really focusing on when the resident cannot be interviewed and when we have to go to other sources for getting that information. And then finally, our goal as a whole for this project is to really look at how you can utilize that information to leverage better care in the daily care that you provide. So let's talk just a little bit about person-centered care benefits. And some of this is kind of preaching to the choir because if you guys are on this call, you already understand that the person-centered care benefits residents, staff, and family members. But just to give a brief overview, the literature is pretty clear in the findings that provision of person-centered care fosters engagement on the part of the resident and improves their quality of life and well-being, primarily because preferences are the avenue toward understanding what is meaningful and purposeful to us all. We prefer those things that are that have specific meaning to us, and that is certainly true for a nursing home resident. It also helps to facilitate the residents' feeling of autonomy and their ability to have their voice inserted into directing the care and the services that are being provided, and certainly goes a long way to creating a care environment of trust and respect and building those closer relationships with the staff that are providing the care. Next slide, please. From the staff perspective, again, the literature is pretty clear that person-centered care has a host of benefits. Staff members are definitely report being more comfortable caring for people that they know, that they have a better, stronger partnerships with the residents and their families when preferences are discussed. And of course, the staff who knows the person's preferences can adapt more quickly to that person's ever-changing needs and requirements for their care and how they like to live their daily life. And then finally, staff who do provide person-centered care are highly valued within their organizations, and the information that they have in terms of knowing more about the residents' preferences and needs helps them to work more efficiently and devote their time where it's needed most. For the organization itself, nursing homes who deliver person-centered care are shown to have better quality outcomes. And again, this is largely due to the ability of staff to more quickly identify and respond to the changes in the resident's condition. Also, nursing homes can gain referrals from people who have had a good experience and recommend the nursing home to others as a place to receive good person-centered care. And then there's also some evidence to suggest that nursing homes have better staff retention, again, due to that building of the relationship between staff and residents. So typically when you would seek to assess preferences, of course, we would ask the resident first. And that interview process in talking with a resident is to find out which preferences are the most important to him or her, how satisfied they may be with whether those preferences are being fulfilled at that moment in time. But of course, what happens if the resident is unable to communicate and cannot be interviewed? So just like we would do with anything related to the MDS or any other assessment tool, we would seek out a family member or friend who knows that resident well to begin the assessment process. So what does the literature tell us in terms of what we know about family members or friends as proxies in speaking for the residents and their loved ones? Well, we know that, of course, families continue to provide support to older adults even after they enter the nursing home. So they're very much there and want to be a part of the partnership of providing care. And then, in fact, families serve a very important role in helping to support individualized care in the nursing home environment. On the flip side, though, we also know that family members are not always fully understanding what an older adult's preferences may be. And this can be a variety of reasons why that is true. Some folks may not have actually provided care to the older adult, or they may live at a distance and not fully understand where the person is coming from in their daily activities and daily needs at the moment. But having said that, the literature is pretty clear that proxy reporters are right more often than wrong in terms of their reporting of the preferences of their loved ones. And so on balance, we know that it is a good idea to go and ask family members about the preferences of their loved ones. So just to say a little bit about some of the work that we've done, we recently completed a study where we were looking at 20 different nursing homes and resident and family member dyads that participated in this study. Next. And the nursing home residents were cleared by a physician for capacity to consent and that they were medically stable. So again, to be clear, we were talking with nursing home residents who could report on their own preferences. Next. And this was using the tool for the PELI itself, which is, as you all know, now a 72-item tool that helps us to assess the importance of everyday preferences in care. And the findings from that study were that you can see here, read through what some of the agreement was between those residents who could speak for themselves and their family member or friend. And these were some of the areas where there were very good agreement in terms of what the resident said they preferred and what the family member or friend reported that the resident preferred. So some nice checks in terms of that if we ask a family member about eating, how the resident feels better when they're upset, what clothes they want to wear, privacy, things like that. These are all things that we can reliably take from a proxy and say that we can care plan around these types of preferences. On the other hand, we look at some of the deviations about where preferences reported by both a proxy and a nursing home resident may be different. And so here, proxies underestimated the importance of the resident's level of importance in listening to music, being involved in cooking, exercise, volunteering your time, being around children, choosing your own medical care professional and how to care for your mouth. So these are things that where the proxy thought that things were not as important to the resident, and the resident said, no, these are things that are on average, very important to me. And on the other hand, there are 3 preferences where proxies overestimated the importance of the preference compared to the resident. So the proxies thought that having snacks available between meals was more important than the resident did. Napping was more important, and choosing what time to get up. So again, these are just some guidelines for you to think about as you kind of use your clinical judgment and in taking the responses from proxies and kind of moving forward from a care planning perspective. So in conclusion, families are getting it right on the majority of preferences. And so really are an important source about the residents' preferences when they can no longer be interviewed.
Great, thank you, Kimberly. So this is Katie, and I'm going to take over from here and walk you through our tip sheet on working with proxies. And you'll find this is a download as part of the webinar. If you have troubles contacting it, we have our emails at the end of the webinar, and you can email us directly, and we can send you these PDFs. So the first piece that we wanted to go over with you in terms of working with proxies is this idea of approaching the resident 3 separate times on different days before determining that the interview cannot be completed. We realize that residents have good days and bad days, and we want to try and approach them different days and times of day to make sure that we really are not able to get information from them. And then decide if you're going to perform in-person interviews with your proxies, if you're going to do phone interviews with your proxies, if you want to do an email survey monkey, or if you want to send it in mail by snail mail, or a combination. So these are some things that your organization will need to think about. And think about Which staff member among your organization will perform the proxy interviews and coordinate with the family or friend proxy? There's been a lot of talk about which family member or friend should be asked to participate in the proxy interview. And this is a process by which you might ask, who among these variety of family members might be the best one to do the interview. And then finally, create an information flyer to include in new admissions folders explaining the reasons why preference assessments are being performed with your organization. So, additional tips in engaging with family and friends is to help the family and friend understand why it is important for providers to know about resident preferences. It's a little bit of education right here, where you have to explain to your family members and to their friends that knowing about this resident will help you provide more tailored care. And it's information to help improve both the medical and non-medical aspects of care, because there's more than just medical parts of care. And it's important to recognize and reiterate that the family or friend voice does not become a replacement of the resident's voice, but that it's a complement in the care planning process. We recommend engaging family and friends by using them as an additional resource for finding further details about resident preferences. They can help discover interests that can be used to create unique and individually tailored interventions. And finally, the family and friends may be interested in serving as a care partner and facilitating activities related to a resident's important preferences. We've heard from some organizations that residents will refuse to go to activities, and they've recommended that family members try to come and go with them to activities, as that may be, it may help facilitate the activity and the resident feeling more comfortable doing those activities. And it's also important to support family and friends in recognizing that despite physical and functional declines, preferences do remain important to the older person. And even if the person is not able to do them well, or is not as involved in the care, it's at these times that we see that family support with the preferences is even more critical. When there's greater decline, that even a small pleasure can be experienced. And with the support from the staff and the activities staff in helping to modify these important preferences to a person's current abilities is crucial. So if you choose to do in-person interviews, we recommend that you find an interview location that is quiet and private. We recommend that you try to work with a proxy to find a time that's convenient for both of you, and be sure that the proxy can hear you to the best of their ability. If the proxy wears glasses or hearing aids, try to remind them and ensure that they're in place prior to the start of the interview. These are similar to some of the tips we gave during our last webinar. And again, review all the interview instructions prior to speaking with the proxy. You want to be fully prepared to decrease confusion with your family member or the friend. And stress how you are seeking what the proxy thinks the resident would prefer, not what the proxy prefers. And this is tricky. It's very difficult for some people to put themselves in their loved one's shoes. They might want their loved one to participate in all these activities, and it's something that you just have to constantly stress. Well, what do you think your mom or dad would prefer? If you're going to do phone interviews, we recommend that you schedule, again, a time of convenience for this family or friend. Double check when you make the call, is this still a good time to chat? For about 20 minutes. and explain the reasons why you're seeking information about the person's preferences. So a sample script that we've provided here for you. Dear Mrs. Smith, my name is Joe, and I'm calling from the Red Hills Nursing Center. Everything is fine with your mother. We are starting a new initiative to learn more about resident preferences, and I was wondering if you had a few minutes to talk with me about your mother's likes and dislikes. I have a few questions that we would like you to answer. We would like for you to take the perspective of your mother and answer how you think she would if she was able. This information will help us provide better care to your mother. So again, feel free to take that script and adapt it for your use. We have not had a lot of success with mailing the PELI to family members and proxies and having it returned to us. And so we recommend this option with caution. I think that you will probably have better success if you try to do an in-person or telephone interview with individuals. If you do choose to do a postal mail interview, try to use a larger font size, maybe a 14 or 16 font size when creating the questionnaires, just so it's easier to read. And you'll want to include a brief cover letter explaining the importance of the family and friend and completing and returning it. And you might want to include the date by which you'd like it returned. Sometimes we all work better with deadlines, right? Include a self-addressed stamped envelope for the family or friend to return with postage paid so they don't have to go to the post office and cover the postage. And we recommend calling with a reminder about 2 weeks after mailing, if you've not received it yet, to say, please, you should have received this. Please complete it and return it. And then that might be a time also that if they've not received it, to send another copy in the mail. And we recommend maybe after a month sending another copy with a new cover letter if need be. And at this point, I want to turn it back over to Kimberly to talk about how you can also engage staff members as proxies if you're unable to find a family member or friend. Go ahead, Kimberly.
Thanks, Katie. Yeah, so as Katie mentioned, there are many instances where a person either does not have a family member or friend to contact, or they're just simply not responsive, live too far away, or the family member or friend is not responsive to the request for information and or says, well, I really can't answer these questions. So in those instances where the resident is both, of course, unable to speak for themselves and we're unable to get a family member or friend, we have to rely on our staff observations and experiences with their direct care work with the resident. So one avenue for doing this is to observe the emotional response of the resident in an activity that you have some reason to think that this is a preferred activity for the resident. And oftentimes staff have a pretty good sense most of the time of what a resident does or does not prefer in a global sense. And this is by observing the person's emotional response to an activity, you can get a better handle on whether that person is indeed enjoying that activity, and signs of enjoyment and interest are signs that an activity is indeed a preferred activity. So here are two examples of interest and pleasure, and the words that are listed on the screen there are the descriptions of what emotion looks like in terms of its nonverbal expression. So things like participating in a task, or having good eye contact, or eyes that follow an object or a person looking around the room, or being responsive by turning your body toward something. Those are all indications of a person who is interested. in what is going on around them, and therefore, again, you're hitting the right note in terms of finding a preferred activity for that person. The same is true for pleasure. So if a person laughs or sings, smiles, maybe makes kissing motions or strokes, gently touching, reaching out warmly, or responding again to an activity such as music, and this may again be signs that the person is experiencing pleasure. Now, the beauty of nonverbal observation of emotion is that observed emotion has been demonstrated through the work of Paul Ekman and others to be culture-free and true across age groups and different types of ethnicities. It is truly universal to how our brains are wired as human beings to express emotion non-verbally using these types of nonverbal indicators. We had done some work a few years ago to test this out in the context of dementia, and we found that even well into the course of dementia, people retain the ability to express emotion through these nonverbal means. So it's something that you can take to the bank in terms of a way of training your staff to look for signs of interest and pleasure, and that if you're seeing these, then you can communicate that to the care planning team that these activities are indeed preferred activities for that resident. On the other hand, if you see signs of negative emotion, such as sadness, anger, and anxiety, then you're in the territory that this is not likely to be a preferred activity for that resident. Sadness, the signs of sadness are such things as obviously crying, but frowning, moaning, sighing, putting your head in your hand. Those are all things that would be an indication that the person may be experiencing sadness at that time and during that activity. Anxiety, on the other hand, can be evidenced by calling out, such as shrieking or being repetitive in what you're saying. Expressions of restlessness or agitation, having deep lines across the forehead with the eyebrows drawn together, hand wringing, tremoring, jiggling, rapid breathing, eyes opened up wide, and in general having tight facial muscles. These are all things that, again, we as human beings express non-verbally when we are anxious. And then finally, anger is probably one that's the most easy to rate. It's hard to miss when someone is angry with you, especially if there's physical aggression going on or cursing, berating, shaking of fist. But there are certainly more subtle signs, such as drawing your eyebrows together, clenching your teeth, pursing your lips, narrowing your eyes, or waving someone away or with a distancing gesture. So the observation of both positive and negative affect the tool I'll show you next here is putting together all of those nonverbal signs in one place about how human beings express different emotional states. And there are some training materials available for training your staff. We have a couple of videos that are available that can help you train your staff to be more sensitive to these signs of positive and negative emotion, and then again, using those as ways of indicating whether an activity is preferred, and if it is preferred, then by all means keep doing it. And the negative emotion is a sign that the activity that is going on is not preferred, and therefore can be something that can be discussed at care planning to figure out how you can turn that negative affect into a positive affect for that individual.
Great. Thank you, Kimberly. And so what we'd like to turn to next is to tell you a little bit about thoughts on care planning. And please remember to put any questions into the Q&A box that you can see in the lower left-hand corner of your screen. We would encourage you to encourage the proxy to attend care planning sessions, either by phone or in person, and track reasons why they aren't able to attend, and potentially engage in a plan, do, study, act cycle, quality improvement cycle, to try to figure out reasons for this non-attendance and make it easier for these individuals to attend. Their insight could be very valuable to moving your efforts forward in terms of person-centered care. It would be a good idea to have a staff member set up a meeting with the proxy and the resident prior to care planning to discuss the results of different tools that you may use. In case you're using the PELI, there's also the Advancing Excellence Person-Centered Care Tool, and develop suggestions for improvement. Or you might have some ideas. You might say, we found this preference is important to you. What are some ways that you might be able to fulfill that preference? And how might it need to be modified and still be fulfilled? And so again, these proxies can be engaged on multiple levels, as information givers and bring assistance to your care planning. So our take-home message really, with all of the work that we've been doing, is that individuals with mild to moderate dementia can still report on their values and preferences. They can do so reliably and consistently. We don't recommend hard cutoffs, such as a certain MMSE score or a certain BIM score, because those cutoffs may not always be the best indicator of a person's capability of responding about their preferences. And so it's really where, as Kimberly mentioned, that you come back to your clinical judgment. And research supports the positive impact of having family and friends involved in care, and the fact that they can provide social supports for a resident even after transition to a nursing home, and can serve as advocates for individualized care planning. Oftentimes, family and friends aren't really sure what their role is now that their loved one is in a nursing home. And you can provide some of that guidance through these structured ways, and really try to welcome them in and say, here are some ways that we can use your help if they are willing and if they have support. Obviously, we recognize that not all residents will have this kind of family support. And so we'd encourage you also to in the question and answer, indicate any facilitators or barriers you've experienced with engaging proxies. I think that that's an interesting piece. The more we hear from you, the more we can help remediate some of these barriers, and then share some of the successes as well. We also want to remind you to submit your questions to us anytime. Even if it's after this webinar, send us emails or call us. Kendall Lesser is our project manager, and she will take your calls. You can remain anonymous if you wish, or you can send us an email. As we've mentioned during the last webinar, we really want to create an opportunity for a partnership so that providers can interact and learn from each other by sharing successes and stumbles, and we want to facilitate that ability. As we mentioned last time, we're embarking on a listening tour and would be honored to visit your facility and learn more about maybe how you integrate proxy information into your care plans, or engage with proxies, or anything related to the preferences for everyday living. We'd love to hear about, as I mentioned, the barriers and the facilitators. And there's Kendall's information again. To find more resources, you can go to the website preference-based-living.com. It's under construction, but there are some resources there right now. We hope to develop it more fully over the coming months. And also, please sign up for our newsletter, and I'll paste the newsletter link into the chat box so that you can You can sign up for that. I just put that in there. Oh, I sent it. Let me send it to all participants here. And then also what we want to let you know is that our next webinar will be in January. So we recognize that November and December are very, very busy months. Lots of holidays, lots of activities going on. And so in January, we will come back to you with our next webinar on promoting resident choice. And so this webinar will help identify ways to support and encourage nursing home residents to state their preferences and direct their care as much as possible. The information that we'll provide reflects best practices among nursing home staff and administrators to overcome both the logistical and the cultural challenges to respect individual preferences for daily schedules, activities, and interactions. And that'll be Tuesday, January 24th from 2 to 3. And again, there's the link for participating in the webinar, and I'll post it into the chat box. And finally, we'll stop here. Our emails are listed. We want to thank you for attending, and we'll go into our question and answer period now. I see we've got several questions added to the piece. And remember to stay, if you're seeking the CEU credits, please stay on until the end so that you can sign out of the webinar and we can process your CEU credits. So, Kendall, how about questions?
All right, yes, we've had a few come in, and one of the first questions is, how important is it for short-term residents to have a detailed PELI and a detailed care plan?
Well, that's a great question. So in our last webinar, we spoke a little bit about this, where we recommend engaging with your long-term residents around the PELI. We recognize that you may only have short-term residents for a matter of days, maybe up to 20 days at most, and they may not see this as relevant to them, and it may be very difficult for you to be able to even put this kind of information into a detailed care plan. And so we recommend starting with your long-term residents on the PELI initiative. And I know that on the last webinar, we had Cheryl from the Ohio Department of Medicaid. She stated that one of her most important pieces is that pain management which is a clinical indicator, not part of the PELI, should be the emphasis for those short-term residents so that they're able to go to rehab and able to get stronger and better to go home. And one other thing that we've mentioned, and then I'll turn it over to Kimberly for any additional pieces of advice, is that if your organization has a home health organization, doing the PELI with your short-term residents might be a great handoff to your home care organization to help them guide care, goals, values, and activities. Kimberly, anything you'd like to share or add?
Yeah, I think that last point is really, really important to emphasize, in that, preferences are something that are inherent to who people are, and as such is something that's really important to think about as people transition across different settings of care. So this idea that you would, of course, everybody collects the MDS Section F in short-term rehab, and so those items, of course, would be important to figure into their plans of care if the person has important preferences. And they will, of course, leave the short-term rehab with those short-term preferences intact. So starting with the MDS Section F, thinking about how those preferences might be impacted by the person's particular reason for why they're in short-term rehab, how that may affect their behavior and their goals following a discharge from the short-term rehab. Those are all really important pieces of information that preferences can provide. So unlike in the long-term care arena, where you're really thinking about preferences from the perspective of providing meaningful, purposeful, tailored daily plans of care for the person who is living in their home, in short-term rehab, people are not living in their home. You're really thinking about preparing them for returning to either their home or their next setting of care. So preferences serve a little bit different purpose within short-term rehab. And I think the short answer is starting with those MDS Section F preferences and making sure that the team thinks about them relative to that person's next setting of care would be an important way to utilize the preference information.
Great.
All right. Thanks, Kimberly. I have another question that came in, and this question is, do we need to use the same response options with proxies as we do with residents?
That's another great question. Kimberly, do you want to take that one?
Yeah, so the simplest answer is to use the same Likert scale as we do with residents, but this has come up in a couple of different contexts, and sometimes even though the MDS Section F preferences are laid out in the exact same response set as the PELI, we actually modeled the PELI after that MDS Section F to make it consistent, because we knew that facilities were already asking using that response set. But in fact, what we found is that it is pretty hard sometimes for people to use that response scale, and that sometimes you can get the information that you're looking for, which is a preference important to that person, yes or no, or mostly yes or mostly no, is really the goal that we're striving toward. So unlike the MDS, where we must use that response scale, within the PELI, there are some options in terms of using the very important, somewhat important as a yes response, and not very important or not important at all as sort of a mostly no response, and kind of moving forward from there. So I think that if you encounter that same type of difficulty with family members, using that kind of strategy for getting at the mostly yes or mostly no, and circling the response accordingly, is referred to as an unfolding process. So that is definitely another strategy that people have used to get the information that they need.
Great. And another question just popped up. What time frame should the PELI be completed in upon admission, and how often should they be updated? And so I believe that most organizations have, is it 21 days to complete their care planning? And so what you're looking at here is, if you want the PELI to inform your initial care plan, it would be important to at least get some items from the PELI answered. And in our previous webinar, we talked about starting with 10 to 15. You can start with the MDS items. You can look at the 72 items and pick the 10 to 15 that speak to the mission of your organization. And those could start the initial composition of your care plan. And then in terms of how often they should be updated, is we recommend that a couple of things. One, we see relative stability in people's preferences over a 3-month time period, which is, of course, as is mentioned, correlated with the MDS timeline. So MDS timelines are done on admission and quarterly. And then during significant change. And so again, we see in our research that if there is significant change in someone's mood, like depression, anxiety, that's a time to reassess preferences as well. Kimberly, would you like to add anything more about that?
I guess I'll just amplify the next question, which is the correlation with the MDS timelines. And as you already mentioned, the stability of preferences we've checked for that 3-month period because that is the period between care plans, between the mandatory care planning period. So in fact, one strategy that you might want to use is to mirror the care planning cycle for when you ask these preferences, so that you have those preferences available to you ahead of that care planning meeting. So how often you decide to do that, and we have had organizations all across the board. Some people try to do a set of preference questions prior to every care planning meeting, every 3 months. Others say this is something that we're going to check on for that person's annual care plan meeting. So, but tying it to their MDS cycle of assessment is a very good strategy because now you have a very holistic look at that individual in terms of everything else, physically, emotionally, socially, that's going on, you know, with that individual, as well as an up-to-date preference assessment.
Great, thank you, Kimberly. We have another question, and that is, what happens if a family member reports his or her own preferences instead of the resident's preferences, or tries to influence the resident's answer during the PELI interviews?
This is another tricky question, and there's several ways that you can move forward. One, of course, is to, again, try to reiterate that you're seeking the resident's preferences, that it's great to know what the family member prefers, and that you'll take that and you'll write that down and you'll take that into consideration. But could they think and sort of put themselves in their loved one's shoes and think about how they might respond, especially since they're unable to communicate right now. And so, again, try to reiterate the need to sort of have the family member think about the resident first, and then they can always tell you their preferences later. And we recognize that this is a ballet that you are putting together here, where you're trying to meet families' expectations, but also some education can come into play here. And this is where we recommend maybe some flyers, and we're working on developing some of those that you can use in terms of how to educate the family member about why these are important and why we're asking them to report as if their loved one was reporting. Kimberly, what would you add?
Yeah, I think you did a very nice job summarizing that, Katie. I mean, and again, the idea that you're gathering information always from the resident as well through your observations of their responses to a particular activity is another thing that you can certainly report back to family members and saying, you know, that in our observation of your loved one, we have noticed that she is particularly interested and experiences a lot of pleasure when she is in this type of activity and not so much in another activity, especially if the family member is advocating for their own preference and not the resident. So that's another thing to keep in mind, is that reporting back to family members about your observations of the residents' emotional well-being when they are in one activity or another that is the activity that you're really not sure whether the family member is reporting their own preference or the resident's preference. It's another strategy to think about.
All right, thank you, Kimberly. I have another question, and it's, what happens if a family or friend refuses to complete the PELI interview? They say they just don't have any time.
Yeah, this is tricky. Again, you may not be able to get this information from a proxy. But what we would recommend doing, again, is trying to reiterate the importance of how the information that this proxy could give you is something that can help improve the quality of care and potentially the quality of life of their loved one. And again, if you're able to sort of par down the PELI into these, a handful of items that is important to your organization, then you can say these are the top 10 most important, preferences that we'd like your feedback on. And could you spare 10 minutes just to talk with me about that? And so maybe trying to do a little education and then ask only what, ask a little bit at a time. And as you're developing a relationship, if they're able to see some improvement or they're able to see how you're putting these preferences into action, then they might be more likely to give you a little bit more of their time and tell you some more things. Kimberly, anything you'd like to add?
No, I think that's a great summary, Katie.
All right, we just had a question come in. Is there a place where we can watch the first webinar? And I will go ahead and put that link in the chat box for everyone to view in a couple of seconds. While I'm doing that, I'll have Katie or Kimberly answer this other question, which is, how much time does the family member need to complete the task before the care planning session? How much?
Yeah, this was sort of similar to what we thought about, what we spoke to early in terms of the earlier question we had is, so if you have someone coming in and you need some proxy information, you might not recognize that you're unable to get information from the resident for a week or two, right? It may take a little bit for the person to get established and for you to develop a relationship. And if you're trying to talk to the resident on 3 different days and times, it may be a couple of weeks. And so, again, what we would recommend is trying to engage the proxy right from the start to say, we may be reaching out to you to get some information about your loved one's preferences. What would be best? Can we reach you by phone, by email? Would you prefer to come in and talk with us? Maybe setting the stage early on so that as soon as you're able to assess that you're just not able to get information from the resident, then reaching out to that proxy is not going to be a surprise. And then, again, trying to say, here are the most important things that we'd just like to know right now, and we'd love to have a longer conversation with you down the road. It just depends on your organization and the policies of your organization, how you're able to integrate this proxy information into the care planning document. Kimberly, anything to add?
Yeah, I think, again, the emphasis on, doing what your organization's policies require, but the only point I would add is that, unlike the MDS assessment, where there is a time limit in terms of how quickly you can ask the information that goes into the care plan. That is not true for the PELI and anything related to the PELI. So thinking ahead, leaving lots of lag time in reaching out to family members to give them an opportunity to respond is a good choice, and you don't have to worry about any other kind of externally imposed deadlines for that.
All right. Thanks, Kimberly. Someone just asked, is there a way to get a link to the printed slides? I know we are recording this webinar, and we are going to post it online within the next, 10 days or so. But Dr. Abbott, do you think we are able to share a link to the actual PowerPoint slides?
We should be able to do that. We can probably put it up on the Preference-Based Living website. So please sign up for the newsletter, and we can put all that information in our November newsletter that'll go out as soon as we have this webinar closed captioned. And again, that link, I'll copy and paste it here so that
I just did.
Oh, perfect. Thank you. So that you're able to get that. And because the newsletter, we can certainly get you that information. And if that doesn't work, email us, and we can send it to you privately.
Okay, and we just had a question that came up, and it says, are they still being tracked? And the person who asked that question, if you can maybe clarify, I'm not too sure I know what you mean by still being tracked, but if you want to send me a message and clarify that, maybe we can answer that question. So we will wait for that. And then another question is, who at the facility enters the nursing home or the data from the PELI when it's gathered from the family members? How is that entered and how is that used with nursing homes?
That's a great question. So really this is up to every individual provider to figure out the processes by which they're going to be collecting this information. And how they're going to use the data once they collect it. Some are using Excel spreadsheets to track their data. Some are doing it via paper and pencil. And so it's really about who's the team of, what's the team of individuals that are helping with this initiative, and how can some of this workload be sort of spread out among the team members so that maybe there's one team member who is sort of the lead person on getting proxy responses. And so maybe there's somebody who'll say, hey, here's Mrs. Smith. I'm unable to interview her. Would you please follow up with their proxy? And then that individual could be the point person. So it's really thinking about what works for your organization. We stayed away from issuing best practices because we think that we can offer suggestions of things that have worked in other organizations, but it really has to be tailored to your organization for it to be a best practice.
All right. Thanks, Katie. So I think those are all the questions. If there are questions you would like us to answer, please email us. Our emails are on the screen right now, and we will get back to you. So if you think about anything after the webinar, please shoot us an email, and we will respond as soon as possible. Finally, I have some instructions for those who are seeking CEU credits. We need you to sign out of the webinar and complete the webinar evaluation. Please click the link in the chat box, which we will put up for you.
I just posted.
Oh, great. Thanks, Katie. And so click on that link, complete, say when you signed out of the webinar, complete the evaluation, and we will send you your CEU PDF within the next couple of weeks. And then if you're not seeking CEU credits, we still would appreciate it if you would complete the webinar evaluation. So you can click on that link, or once you exit out of the webinar, you should be prompted to complete a quick Qualtrics survey with the webinar evaluation. So thank you so much for joining us today, and be sure to sign up for our newsletter where we will have a recording of this, and you can get all of the updates about the Ohio Pelican Project. Thank you so much. Have a good day.
Thanks, everybody.